Hi guys, how are you doing? I hope you are doing good. Just coming to see how everybody's week was. I am coming to you to talk about yearly labs that people usually get. There is a whole list of labs, but I'll just go through some basic labs that you can get from your doctor's office as a yearly check when you go in. Some people go in once a year, some people go in every 6 months, depending on what they find. But if you're one of the people that goes in once a year, these are the labs that they usually do. So they're going to do something called complete blood count, that is referred to as routine blood work. You don't need to fast for this lab. You go in, they do the lab. It's used to assess overall health and organ function, measures your red blood cells, white blood cells, hemoglobin levels, other blood components to check for anemia, infection, or even cancer. It has the white blood cells, so if those are elevated, they can check for cancer. But this is just a general test that most insurances cover, and if they don't cover, it's not so expensive. You will know if you are anemic from this test because it has the hemoglobin level. So it is one of the recommended yearly blood tests. It's called, it will go by medical term, people will say CBC, but the complete blood count is the full name for it. So that's one of your yearly labs that you can request. Most doctors offer it without you requesting, but that's one of the tests that you should request when you go in for a yearly check. The other test that we do is called a hemoglobin A1C, and this does check if you have diabetes. And what a hemoglobin A1C is, it measures your average blood sugar over the past 3 months. So you go in, they take it, it's used to diagnose prediabetes and diabetes. There are levels that will tell you if it is less than 6.4, you're good. If it's above 6.4, then you're diabetic. So your doctor will tell you you're pre-diabetic. I want you to start working on your diet based on this test, the results of this test. I want you to start working on your diet, because if you do work on your diet, you may never become a diabetic fully. So hemoglobin A1C, average blood test over a period of 3 months. It's going to tell you whether you have diabetes, whether you're close to diabetes, and if you're close, they just talk to you about it. You start exercising, eating right, and it goes down. Or if you don't do those things, then it can throw you into diabetes, where you have to start taking pills for the diabetes. You can get this test once a year. If you have risk factors for it, risk factors is if you're overweight or you have a family history of diabetes, it's good to request the test so that you can have it done for you. Another test we do is called the lipid panel. This one checks your cholesterol. So it measures cholesterol, which is HDL and LDL and triglycerides, and this helps determine your risk for heart disease. So this is a very important test that you can request when you go to your doctors. If you have high cholesterol, your doctor may want to consider to monitor it or start you on medication for it. So this is a very important test. Have it done when you go. It's part of the yearly panel. They have age screening by age too. So there are those general labs that you can go in and say, I come in once a year. These are the labs I would like to have done. Usually a complete blood count, basic metabolic panel, hemoglobin A1C, and a lipid panel. And in the process, they're also going to check your weight, and they check your blood pressure every time you go in there. Occasionally, the other thing you can do is get into the habit of checking your blood pressure when you're at home, or anytime you get into the store. King Soopers has blood pressure cuffs. Walmart has blood pressure cuffs. Most of the stores have blood pressure cuffs. You can check your blood pressures and see how you're doing. If it is anything less than 130/80, then you don't have high blood pressure. Anything above that could start taking you towards having high blood pressure. The reason I encourage people to do this is because some people, when they take their blood pressure in the doctor's office, because it's not a familiar zone, their blood pressure is always high. And when they go to a store, let's say King Supers or Walmart, the blood pressure is normal. So if you're that kind of person, there's a medical term for it. It's called white coat syndrome. If you're that kind of person who gets high blood pressure at the doctor's office, the other thing you can do is just take it at King Supers or Walmart and record it. So when you go into a doctor's office and they say your blood pressure is high today, is this normal for you? We'll need to monitor your blood pressure. Then you can give them the readings of the other blood pressures that you have gotten when you're in a store or at home. If you have a blood pressure cuff at home, you can give them the readings for that. Other annual screenings that we get by age, anybody from 18 to 29, you can get a lipid panel, but also if you're sexually active, get an STD panel, because that age is rampant for STIs. Anybody can get STIs, but a lot of them happen between the age of 18 to 29. I don't know if it's more of the experimenting or the youngness about it, but that is where most STI happens. Granted, they can happen to anybody. So it's good to get that checked when you're between 18 and 29 and know what signs and symptoms of the sexually transmitted diseases are and what it is you can do. Most people will do the test without asking you questions or without being judgmental, so don't be shy about it. The age between 30 to 39, you want a lipid panel, you want a complete blood count, you want the hemoglobin A1C that tells you if you're diabetic or not, and then you still, if you're sexually active, you still want the sexually transmitted disease panel. You can have that done too. So that is 30 to 39. 40 to 64, you get the lipid panel, the hemoglobin A1C, and the complete blood count. Most people request the basic metabolic panel because they just want to see where their electrolytes are, and that's okay to request that too. You can ask to have that test done. So any of those tests will give you a baseline of where you are. And also, when you go into the doctor's office, they're going to do a weight on you and they're going to do a blood pressure. Those are standard. So those are standard, but the lab work comes with, the general lab work will come with the lipid panel, complete blood count, basic metabolic panel, hemoglobin A1C. Some people have fatigue, and if they do have fatigue, they may add on there a thyroid panel just to see if your TSH is normal. Is it too low? Is it too high? So that's another test they can add on there. If you're one of those people who are saying you have fatigue, they'll do a CBC and they can add that on there. So those are tests, those are general tests that we recommend everybody to have, so you have a baseline of where you are, you know. 65 and above, they also have lipid panel, hemoglobin A1C, complete blood count, and many other tests. I'm talking about blood work. When you go into the nitty-gritty, then you have more tests. You have the bone density test, there are many tests to go in. This is just a general annual, I'm going to the doctor, what tests can the doctor do for me once a year? But if you go into stage by stage, then we have more tests. You have the colonoscopy. These are not blood work now. You have the colonoscopy, you have the DEXA scan, you have this, and I can always go into that. They are a little bit wider, but I was just starting with the general blood work that you ask when you go to your doctors once a year or twice a year for those who go twice a year. Once in a while, you'll go, your blood pressure is elevated, and the doctor says, come back and see me in 3 months. Or cholesterol is high, and the doctor says, you want to change your diet, you want to change how you eat, come back in 3 months and see me. If it is okay, you don't need to start on medication. If I recheck the blood work and your cholesterol is still high, then we may need to start talking about, let's start you on a cholesterol medication to help prevent coronary artery disease. They are good labs because they give you a baseline of where you are. Some people, it helps them get into gear, start working out, start eating right, that they never get on medications. And some people eventually do get on medications. So these are your general tests that you can ask to have once a year. Depending on the insurance you have, if you're within network, most insurances will cover basic work, But if you go to a place that doesn't cover your insurance, you may have what we call a copay, where you have to pay for some part of the labs. So it's important to always stay in network if you can help it. You know, sometimes you can't get a doctor within network, or you like a doctor that's out of network. That's okay too. All you know is that you'll have some expenses to pay out of pocket because this doctor is not in your network. Let's say you have United and your doctor doesn't cover United and you like him, so you go to him. He will order the test, you'll just pay a little bit more. You'll pay a little bit more for this test. So it's good to get us this test: complete blood count, lipid panel. They may throw in a thyroid panel if you have any fatigue or feeling tired or anything like that. Basic metabolic panel, and then the hemoglobin A1C. Some people will want to have a vitamin D level checked. You know, most healthy people, their vitamin D is okay, but you'll be surprised that other people, vitamin D is low. So that's another test that people add on there. These are just basic tests. Now, if we go into detail, there are many, many more tests that we have to go, and I'll probably come back with that and do age recommendations and what you need to do at a certain age. 18 to 25, this is what you do. 25 to, we can do that. It's a lot longer. It would make for a longer video, but we can always do that. But go to your doctor once or twice a year, have your yearly blood work done. Doesn't take too long. They'll check your blood pressure and they'll check your weight there too. And you can, it's preventative care. You want to do that so that you don't get, when it's too late, you go in and, oh, you're already diabetic. Guess what? You have to start insulin. While if you went in earlier and they did the yearly tests, they would have caught it and told you, we need you to start exercising and working out so that you don't get to be a fully diabetic. So I always recommend people to have their yearly labs done and be proactive with your health, and that prevents lots of diseases. Thank you so much. You guys have a great week. I'll come back with another topic. Bye-bye.